testing for the Neuro Screen. So first of all, Reflex is my favorite reflex hammer. I struggled a lot with reflex testing in the beginning, using those really crappy, free, light hammers with the triangle, red, pink, whatever you want to call it. This is top heavy. Yes, this is an expensive hammer, it's about $70, but reflex testing has never been easier with this. So that's that. In terms of technique with holding the reflex hammer, it's really important that you get the technique down and you learn how to flick the hammer with the wrist and the finger setup. So ideally what we're going to do is we're going to essentially balance the reflex hammer on the index finger so that it's basically just balancing here. Then I'm going to take my middle finger, and my middle finger is going to create a little flick maneuver, and then I'm going to superimpose a wrist flick at the same time. Okay? This testing can sometimes be painful, especially at the tricep and especially at the patellar tendon. So you don't want to be hammering with the elbow and the shoulder. So it's really just getting that flick of the finger and the wrist together. Okay? So now let's go ahead and do a lower quarter reflex screen. Okay? So we're going to start in the seated position. It's really important that we fine tune the tension of the tendon to really get that stretch reflex that we're trying to screen with reflex testing. So we're screening for the L3, L4 segments by doing the patella tendon. So I'm going to find that point between the tibial tuberosity and the inferior aspect of the patella. I want to make sure that I hit that spot. So I'm going to use my technique here, and I'm going to flick. And it doesn't have to be a lot. Okay? Now, if we're not getting a reflex, what we can do is we can play with the tension of the patella tendon by manipulating the position of the knee. So if I just take that knee into a little bit of extension, so go ahead and totally relax for me, just be totally dead there, good. And then just let yourself relax on my leg, good. And I'm going to now do the same thing again. You can see how we just got a little bit better of a response by manipulating the tension of the patella tendon, okay? If it's too much tension on it, for example, right, it's harder to get that reflex. So play with that, okay? I like being on this side so that I can play with the position of the knee, okay? I'm going to switch sides to try the other side, okay? Excuse me, I'm not gonna do that. You're gonna stay on this side to test both sides, especially if you're a righty. Okay, if I need to play with the position, again, I can either use my hand, okay, now I'm a righty, so I actually switch sides to test the patellar reflex, the Achilles reflex, excuse me. So I'm gonna come over here, I'm going to play with the position of the foot to bias the tension on the Achilles tendon. And notice the flick of the finger and the wrist. Good response there and here. Now a little trick, if you're not getting a good response at the Achilles, okay, we can lay her down. Go ahead and lay on your stomach there. On your back, excuse me. Okay. I'm going to come up like this. Okay. I'm going to create a little bit of a hugging of her knee in my armpit here. And then what I'm going to do is I'm going to basically use the smaller surface area of the reflex hammer, and I'm going to hit right at the head of the 5th and 4th metatarsals to see if I can get a better response. And you can see how I can get a better response there. That's if the Achilles response isn't getting you what you want. So here, I'm going to bias that tension here, and and you can get a response. Now, if we have a really acute lower back and they're more comfortable in supine, I actually may test them in supine, the reflexes that is, the dermatomes, the myotomes, so that they're not uncomfortable sitting, especially if we have flexion intolerant back pain. So in that case, this is how I would test these. So go ahead, come around the table. This is how I would test the reflexes in supine. So go ahead and scoot back for me. Okay, again, so to play with the tension of the patella tendon here, I can use my thigh or I can use a foam roller, see what I get for a response here. And I'm just feeling the quad for its response. And again, notice the technique. It's really important to, so that's all I need. I just need to see, can I get a response? And I'm comparing left and right side to see if we have a diminished reflex, if we have a hyper reflex. You see this one's a little bit more reactive. If you're more comfortable switching sides, that's great. If you want to stay on the same side, you can as well. But just so you can see the different variations of how to test, I can also test the reflex here. She actually gets a better response when I flex the knee and hip. So bias that tension. Okay, so that's the quick reflexes for the lower quarter. All right, for neuro screening, dermatome testing, light touch. I like using a pinwheel. These are very cheap and it's very easy to have reliability with this. You use essentially 2 fingers, the thumb and the index finger. You just use the weight of the pinwheel and you're just rolling it right on the patient, okay? Very easy, very repeatable, okay? So for the lower quarter, we're going to screen L3 all the way to the S1 dermatome. So this is how I would talk to the patient. All right, Sam, I'm going to run this on your cheek just so you can get a baseline for how this feels, okay? I want you to let me know if it feels the same or different compared to the left and right side, okay? So does this feel the same as this?
Yes.
Good. Does this feel the same as this?
Yes.
Very good. Does this feel the same as that?
Yes.
Good. And does that feel the same as that?
Yes.
Very good. Okay, we can do the same thing in supine if we have a hot lower back coming in and you're uncomfortable in sitting. All right, Sam. Just for a baseline, that's what that feels like. Does this feel the same as this?
Yes.
Okay. Does that feel the same as that?
Yes.
Good. And does this feel the same as this?
Yes.
Good. And does this feel the same as this?
Yes.
Very good. Okay. Very simple, very quick. That's dermatome testing for the lower quarter. All right, so myotome testing for neuro screening. So what we want to do is we actually want to give ourselves, the therapist, the leverage or the advantage, and the patient the disadvantage in terms of leverage, especially if you're a female testing a male, or especially if you're just a smaller person testing a larger person, okay? This also gives us a way of being able to actually assess left and right weaknesses and subtle differences in myotomes, especially when we're dealing with a acute or subacute lower back. So if you scoot all the way over to me, we're going to start with the L3, L4 myotome, so that's the quad. So here's how I will instruct the patient. All right, Sam, I want to test your quad strength. So I want to test your ability to actually kick out with your knee. We don't want you to kick out with your hip like that, okay? So what I want you to do is I'm going to slowly bring on my pressure and I want you to resist me. So I'm going to set myself up like so, okay? Just so you can see, if you go right over here, Katie, scoot over here to me, man. Okay. Have them right up against the edge. I'm right up against the table, and I'm basically having their shin right up against my body, or right up against my lower rib cage here. And then I'm going to go ahead and hold on to the table so that I can get a good taste of their quad strength. Okay? So I'm going to have you start to kick into me in just a little bit. Good, just like that. Good. Hold, hold, hold. And we're going to do a break test here. So I'm going to really test, can she hold? Good, and then relax. Good. And we test the other side. Compare left and right. Good. So here, good. I'm going to stand on the opposite side of the table. I'm gonna bring her leg in towards me like so. I'm gonna have her bring her foot up and in like that until I see the tendon of the anterior tib pop up at me. I'm gonna take the palm of my hand, place it on the first metatarsal, okay? Cupping it like this, lumbrical grip. My elbow is gonna be up against my body. I'm gonna provide her with stabilization here for her leg so that I'm not testing anything up the chain really. And I really want to get a taste for the L4 myotome. So here's what I'm doing with my body. I'm literally just leaning into her body, or her foot that is, so I clearly have the advantage. So I'm not muscling it with my arm. So I'm here and I'm here, and then I'm just resist me, Sam, don't let me push you down and out. Hold, 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 and we should be able to break them. Go ahead and hold again. Hold, 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 and relax. And here's what I usually tell to the patient. Sam, I'm cheating. I clearly have the advantage here. I'm using my whole body just against these little muscles. So I'm expected to win, but really what I'm trying to look at is there a big difference between the left and the right? Because I really want to taste and get a sense of the health of your nerve. Does that make sense? So I'm going to look at the other side. So come on over here. Good. Scoot over a little bit. I'm going to bring that in. Okay. Up and in with the foot. Good. Just like that. Beautiful. Okay. I'm going to stabilize her leg with my forearm. I'm going to set myself up here. And I'm going to weight shift into her foot to see what do we got for strength. Good. And again, I'm looking for left-right asymmetry here. I'm not this isn't a true strength test. This is a neuro screen. So if I can easily break her on this side, right, and that's not painful, but it's weak, and on this side I have to give some oomph, well now I'm starting to be a little concerned if there's something going on at the L4, L5 nerve root, for example. Okay? Now here's another way to test this. If you don't like this setup, some people think this is really awkward. Okay, what you can do is you can have her go up and in like this. You're gonna then stand on the same side, okay? You're gonna grab the foot like this, provide stabilization at the shin like that, and now I'm just doing a push-pull pattern to test her strength. Okay, so whatever you prefer, I'm here. Stabilization is key. I'm not trying to test her adductors here. Right, so I want to give her that stabilization, and then I'm going to say, okay, can you hold? Hold, hold, hold. Good, okay? Now, we're going to go and test eversion, so L5S1-ish, okay? So we're going to go here, so evert, similar position here. I'm here, so you're going to come around the table, okay? Very good. There, I'm going to provide stabilization. I'm going to lumbrical grip at the 5th metatarsal, okay? And now I'm trying to push her down and in. So hold, again, I'm weight shifting just like I did with the L4 myotome. Hold, 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 hold. Good, nice job. And again, come on, hold, give it to me. Come on, come on, come on, come on. Hold, good. That's it. I'm gonna do the same thing on the other side. Okay, we're gonna evert. Good. And stabilization. My elbow's up against my body, and I'm weight shifting into her foot. Ready? And hold. Good. Again, come on. Right up into my hand. And hold, 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 hold. Good. Now, same idea for this one. If that's awkward for you, you can do the same thing here. I'm going to cup her foot like this, provide stabilization here, and now I'm going to lean back and pull. Try not to pull skin. Ready? Hold. Very good. That's it. Awesome. Okay? To test the L5, I'm going to look at big toe extension. So I'm going to hold the plantar surface of the foot, grab the thumbs, grab just proximal to the nail, and I'm going to just lean back with it and get a taste. Do we have a left-right asymmetry? Good. Nice. You doing big toe curls in the gym? That's pretty strong. Well done. Okay, so that's lower quarter myotomal testing for the Neuro Screen. Okay, so this is a a neuro screen for the lower quarter. If we are suspecting some type of posterior lateral disc herniation that's affecting the nerve root, and we're getting some painless weakness in myotomal testing, and we have a subacute or acute low back pain coming in, the tuning fork or vibration testing is a very sensitive test to pick up on if there is any type of pathology in the nerve root in the lumbar spine. So we're basically going to test their ability to pick up on vibration at the very distal part of the hallucis or the big toe. So with that, I'm going to basically ask the patient, Sam, I want you to close your eyes. Here's what this basically feels like. Okay, I'm just going to put this on your cheek so you can feel. You feel that vibration? Good. I'm going to also give it to you at your finger. Do you feel that vibration? Okay. Okay. And you feel how this is not vibrating?
Yeah.
You feel how this is vibrating?
Yes.
Okay. So I'm going to have you close your eyes, and every time I touch your big toe, I want you to tell me, is it vibrating or not?
Okay.
Okay. So I'm basically going to intermittently allow it to vibrate. And while she's closing her eyes, I don't want her to associate that tapping sound with a vibration or not vibration. So sometimes I'm going to tap and touch. Sometimes I'm going to tap, then I'm going to grab this, make it stop vibrating, and touch so that she can't differentiate the sound with what I'm doing in terms of the vibration. So go ahead and close your eyes for me, Sam. Now tell me, is this vibrating or is this not vibrating?
Vibrating.
Good. Is this vibrating or is this not vibrating?
Vibrating.
Good. Is this vibrating or is this not vibrating?
No.
Is this vibrating or not vibrating?
No.
Is this vibrating or not vibrating?
Vibrating.
Good. Is this vibrating or is this not vibrating?
Vibrating.
Good. Same thing on the other side now. Is this vibrating or is this not vibrating?
Vibrating.
Good. Is this vibrating or is this not vibrating?
Not.
Okay. Is this vibrating or not vibrating?
Vibrating.
Is this vibrating or not vibrating?
Vibrating.
Is this vibrating or not vibrating?
Not.
And how about this?
Not.
And how about this?
Not.
And that.
Vibrating.
Very good. Very accurate. And no, some patients, when I've had this happen before, they have a hesitancy and they seem like they're questioning whether it is or not. So really pick up on that. Okay, it should be very clear. It should be very, they should know it right away. It's very easy to pick up on that if there is no pathology going on. Okay, so that's the quick vibration test for if we're suspecting some type of structural pathology in the lower lumbar spine.